Are you having a patient with neck pain that's also experiencing shooting pain down into their arm, perhaps some numbness and tingling? Don't worry, in this video, we're going to cover everything you need to know about cervical radiculopathy, including a cluster of tests that, when you have them together, can improve your diagnostic accuracy. So the first thing we're going to do to break down cervical radiculopathy is define what it is and then talk about the signs and symptoms. So cervical radiculopathy is, as it sounds, it's some type of nerve or irritation that's happening in our cervical spine. Typically, it's going to be somewhere in the mid to lower cervical spine region, so our nerve roots are going to exit on either side, and that's what's going to cause the pain down into the arm. This can usually be acute or chronic. So you may have somebody that comes in and a few days ago something occurred and they had a sudden onset of neck pain and they're starting to have some referring symptoms to the arm. It could also be somebody that's commonly middle-aged that's been having some ongoing neck pain for the past couple months, and then all of a sudden they're getting some shooting pain down into their arm. Typically, you're also going to have some potential weakness. This is where an upper quarter screen is going to come into effect, which we'll talk about in the exam. So you're going to want to look at that. It can be unilateral or bilateral. Oftentimes it's going to be on one side, but it can be on both sides. One of the biggest drivers, which we talked about initially, is that referred pain coming down into the arm. So anything that's putting that nerve on tension is going to reproduce their symptoms. So patients may tell you that when they're driving, holding a steering wheel, or if they're reaching, having their arm extended, anything that's putting it on tension is going to reproduce their pain. Now, something that they will actually do is they'll try to unload that extremity. And you may hear something that's called the Bacodi sign. What that is patient may say, when I put my arm up like this over my head, it feels better. And essentially what that's doing is, if you think about a string, it's giving it a little bit of slackening, and it's going to reduce the symptoms that they have. So these are the big things that you want to keep in mind with radiculopathy. Oftentimes, local neck pain may or may not be the biggest complaint. They're usually going to have symptoms going down into the extremity. It can go as far as the fingers. It could be up into the elbow. It could be at the shoulder. It could be acute or chronic. You may have some weakness associated. And again, it could be on one side, which it commonly is. Sometimes it can be on both sides. You've done a detailed subjective exam. You've asked the right questions. You're thinking that this may be a cervical radiculopathy. This is the cluster that you're going to want to utilize to help you rule in and really be confident about diagnosing cervical radiculopathy. This was developed by Wainner et al., and there's 4 different clinical exam components. The first of which is rotation of the cervical spine to the involved side less than 60 degrees. So let's say they have right-sided neck pain and arm pain, and they rotate to that side less than 60 degrees. That's going to be the first component. The next, you can think about it as compression or irritation of the nerve and releasing and opening up the nerve. So our nerves like space, they like blood flow. So what you'll have is a positive Spurling A. There's a Spurling A and a Spurling B. Spurling A involves a combined side bend with extension and providing an axial load to the cervical spine. And typically you'll have a reproduction of the familiar symptoms for the patient. So that's where you're getting that irritation or compression. If you want to release some of the symptoms, you'll have a positive distraction. This can be done seated or supine. Essentially, you're providing a distraction, opening up the spaces where the nerve roots are exiting. And typically a patient will report a relief of their symptoms. So here you're getting relief. And the last thing is putting the nerve on tension with an upper limb tension test, specifically upper limb tension test A. There's A, B, and C. This is for the median nerve. So our median nerve is commonly involved with the cervical radiculopathy. We do have a video for that, which we can reference in our show notes. Essentially, you're bringing the arm up and out and extending, and you're looking for a reproduction of symptoms. It's always important as well to compare this to the opposite extremity to ensure that they know what neural tension feels like and if it is a reproduction of their familiar symptoms. Now, what's great about these clinical tests? What's been shown in the literature, so we have 3 out of 4 that are positive. You have a likelihood ratio of 6. Positive likelihood ratio of 6. Now, what does that mean? That means that there's a likelihood that if somebody has 3 of these 4 tests positive, that they have cervical radiculopathy. If you find that there's 4, all 4 of these are positive, jumps up to 30. So you can be quite confident if all of these tests are positive that your patient has cervical radiculopathy. Now, you don't want to look at just these tests alone. It's important to, again, look at your clinical history, look at the entire presentation of the patient, and make sure that you're coming to an accurate diagnosis. To close out cervical radiculopathy, you want to ensure that you're having a detailed subjective history, gathering those findings, screening for your red flags. You want to use the cluster that was just reviewed and putting those tests together to increase your likelihood ratio of diagnosing cervical radiculopathy, which is going to ultimately give you that accurate diagnosis. We appreciate you guys tuning in. If you want to see some more videos similar to this, please drop in the comments what you guys would like to see. We'd love to produce some more for you. And be sure to like, comment, and subscribe to our page. Can't wait to see you for the next one.